Hello, I'm Dr. Perry here at Farmington Family Dental. We get a lot of questions about Invisalign. So today I'm here to answer some of your questions, some of the most common in the topic, to help you better understand what Invisalign is. Invisalign is a clear aligner that snaps onto the teeth to straighten or change the position of the teeth. Think of it as braces, but with a different technology. Instead of having band and bracket with metal, it's done with plastic that's clear and hence its brand name, Invisalign. Most of the time you don't see it. Invisalign is like traditional braces in that it straightens teeth. The cost on it tends to be a little bit higher than traditional braces, but in many cases it can be done faster and more comfortably than traditional braces. As far as in dentistry's hands, Invisalign is a better product in most cases than traditional braces are. Oh, speed, Invisalign versus braces. Invisalign is usually faster. Usually, but not always. There are cases where using wires and metal is quicker. But if it's small movements, Invisalign is typically much quicker than traditional braces. Invisalign is often considered more comfortable than traditional braces because when we move a tooth with Invisalign, it's just one or two teeth at a time. We can be targeted and precise, so we don't have to do the whole shebang at once. With traditional braces, they use an arch wire, that wire that you see on the brackets. And that wire itself forces every tooth at the same time to move. There's a lot more movement involved all at once, and movement equals soreness. So Invisalign or clear aligner therapy is much more comfortable than traditional braces in most cases. So how long does Invisalign take? Really, that depends on how much movement needs to happen. The best way to find out how long it takes, come in, we'll do a scan, we'll do it all digital, and we'll send the plan out to our clear aligner provider, and we can give you an estimate of how long it takes to do the work. What is the process involved in doing Invisalign treatment? Well, the first step is coming in, get a diagnosis, find out what we're trying to accomplish, and make sure we're using the right tool for the job. Then we'll take an intraoral scan, no goopy impressions. That stuff tastes gross. The intraoral scan is a little bit quicker, and there's no flavor with it. Once we have that digital scan, we send it out up to the cloud where a lot of things go, and we start tweaking it to make our plan for making the braces, for doing the clear aligners or Invisalign. Usually takes us about a week to have that process done. At the end of that week, we bring you back in, we show you the end result so you can see what we're thinking about accomplishing and how long it takes to do it and what all's involved. And then we order the aligners. Invisalign trays are clear plastic trays that fit on over top of the teeth. They're used to straighten the teeth. Invisalign is a brand of tray. There are many out there, and they're all pretty good. How many you need depends more on how many teeth you need moved and how far they need to move than anything else. Really, that's a person-by-person thing. You can best tell. Come on in. We'll show you what it takes to move the teeth and how long it takes to do it. Great question on sleeping with Invisalign. Absolutely. In order for clear aligners to work, you must wear them throughout the day. The bare minimum is 18 hours a day. Really, you'll get better results if you only have them out for eating and brushing, nothing else. And you're probably not drinking anything but water without taking them out, cleaning everything up. But you're wearing them most of the day. The longer you can wear them throughout the day, the more predictable you'll track along our plan. Some people ask, is there anything that makes it so you couldn't use Invisalign? The first thing I'm thinking of is where the teeth are. Is it a good product to deliver the result that you want? That would be some, come on in, we'll be able to tell you about it. Second thing I'm thinking, compliance. Some people know, and they know who they are, they're not going to wear them. If you're not going to wear them, they're not going to work. With traditional braces, they're glued on. They're not going anywhere. There's really little compliance issue. But with clear aligners, you need to actually wear them. And then the last thing I'm thinking, anyone who's going in braces, you got to come in. You got to make sure there's no decay on the teeth. Decay has a way of spreading much, much quicker when you're in clear aligner or braces therapy than when you're out. We need to make sure that's not a problem for you. As long as those things are cleared up, that should be a good candidate for care. Okay, first, sometimes people ask me about crossbite. Can Invisalign fix it? And I want to start by talking about what a crossbite is. So normally when the teeth come together, they come together kind of like this, with the back teeth holding the load and the front teeth overlap just a little bit. But some people, with their bite, they'll have situations like this where the lower jaw isn't lined up and it could be off to the left, or it could be off to the right, or it could be further forward or further back like this. When that difference in shape of the lower jaw or position of the lower jaw is significantly different from the upper, Invisalign is not likely to be a good product to deliver the result you're looking for. In situations like that, typically, I would see a need for some type of surgery to reposition the lower jaw to where they match up better and then straighten the teeth. The Invisalign can accomplish the straightening part just fine in a lot of cases, but not every. And sometimes there's a limitation that way. But the bigger limitation is not just Invisalign. Braces can't accomplish it without that additional surgery in many cases. Now, all of that said, sometimes when we start doing treatment for Invisalign or any orthodontic treatment, we plan on not addressing some of those, they're called skeletal differences. Like when the lower jaw skeleton is that far off, it's a skeletal issue. And sometimes we plan on finishing just a little bit different, something like this that's still functional, that still looks nice, but we don't aim to address it because people don't always want to go through the surgery or do that far as the treatment goes. And we can accomplish something like that with some minor functional compromises to do it. And in those cases, Invisalign is still back up on the table. Dental insurance and Invisalign. Dental insurance usually doesn't discriminate or discern between Invisalign, other clear aligners, or traditional braces. Most insurances cover something like one instance of orthodontic care, Invisalign, braces, whatever, per person. Some don't cover it at all, and others will cover it multiple times. It really depends on your individual insurance. That isn't something that's hard to find an answer to. If you come in, bring your insurance card, and the gals here will run that and show you what your insurance covers or does not cover as far as orthodontic treatment goes. Cost of Invisalign. In our office, we run about $6,500 for braces. Whether it's Invisalign or banded bracket, we charge about the same. IC numbers all across the board, depends on where you have it done. Anywhere from about $8,500 on down to maybe $5,500 is probably the lowest I've seen. It really depends on where you go and what they're trying to accomplish with the treatment more than anything else that affects the cost. You can schedule an appointment to talk about this anytime by calling our number. We're Farmington Family Dental at 573-756-5760. Give us a call. We'd be happy to help you out. I'll talk to you about the different options available to you and answer any questions you have.